This report assesses the technical and commercial viability of nanorobots achieving human immortality by 2030. Futurist Ray Kurzweil makes this claim based on the convergence of three exponential technologies: AI, nanotech, and genomics. While such a vision exceeds current scientific limits, several leading firms are making tangible advances in nanomedicine, regenerative technologies, and the convergence of AI and biotech. We identify three companies pushing the state of the art. In the next section, we examine how nanorobotics is being applied to solve real-world problems in biomedicine today. Section 3 will discuss the scientific realism of Kurzweil's projection that nanobots will enable human immortality by 2030. In Section 4, we'll review the regulatory and ethical considerations surrounding the development of nanorobots for longevity purposes. And finally, in Section 5, we'll evaluate the commercial potential of this technology and identify key players to watch. Nanorobotics in biomedicine. Today, nanorobotics is being applied to a range of important problems in biomedicine. These include targeted drug delivery for the treatment of cancer and autoimmune disease, regenerative cell therapy, biosensing, and diagnostic nanodevices. Most of these applications are in the early stages of development, typically at technology readiness level, TRL 3 to 5. Several firms are pursuing active nanobots. However, some have achieved a higher TRL by using nanoformulated drugs that do not require active systems. Kurzweil's projection. Kurzweil projects that by 2030, nanobots will be able to heal tissues at the molecular level, prevent disease before symptoms arise, and eliminate metabolic constraints, such as the need for caloric intake without weight gain. These nanobots would essentially reverse the aging process and allow humans to live indefinitely. While these capabilities are not yet possible, Kurzweil's projection is partially echoed by several active firms. Scientific feasibility. Despite significant progress in nanotechnology and biotechnology, there are still major obstacles to overcome before we can even begin to approach immortality. These include developing effective strategies for navigating within the bloodstream, in vivo control and coordination of large numbers of nanobots in real time, ensuring biocompatibility and long-term safety. We conclude that immortality by 2030 is not feasible given current scientific constraints. However, incremental breakthroughs in life extension are occurring. Regulatory and ethical landscape. From a regulatory standpoint, the FDA and EMA have limited precedent for approving autonomous nanobots. However, nanodrug delivery, for example, by Nanobiotix, is being approved within the context of cancer therapy. From an ethical standpoint, major concerns include socioeconomic access, privacy of biosensors, and human enhancement. Public acceptance of longevity-focused interventions will likely depend on transparent communication and engagement. Commercial assessment. The longevity economy is expected to exceed $600 billion by 2035. Investors are increasingly shifting toward preventive, programmable therapeutics. Strategic acquisitions and partnerships are on the rise, such as when Big Pharma acquires nanotech IP. However, there are significant risks to consider. High capital burn rates, uncertain reward timelines, and the potential for overvaluation based on speculative tech. Moreover, societal and legal constraints could delay commercialization, conclusion, and recommendations. While the prospect of immortality through nanorobots by 2030 remains visionary and unproven, leading players like Calico, Altos Labs, and Nanobiotix are making real progress in adjacent longevity technologies. We recommend a portfolio approach that includes investment in firms with regulatory progress or strong scientific leadership, strategic collaborations with AI biology leaders like Calico for non-equity joint R&D ventures, monitoring of key scientific milestones such as clinical trials, FDA fast tracks, and AI biotech integrations, and planning for scale by establishing frameworks for scalability, biocompatibility, and public trust. This has been an executive due diligence report. If you'd like to receive our full report, please contact us at the provided email. Thank you for watching.